my name is Frank Dolan Jr. I'm here to take you through our first installment of our video coaching series. What this is going to be designed to do is to help you pick specific exercises that are going to help you maximize your results here in the gym. In the first half of the low back episode, we covered from the hips down. Now what we're going to do is make sure that we have enough mobility and stability in our upper back. Okay, usually when the upper back gets locked down from sitting down a lot, poor posture, what's going to happen is the upper back gets really tight, and then the lower back has to compensate and make extra movements. Just think about driving in a car. If you have to go ahead and turn and you don't use the mobility in your upper back, you're going to use your low back. And really the low back is only made to have a couple of degrees of rotation per segment of your spine, so we don't want to try to get a lot of range of motion there. We want to try to resist rotation here, have mobility in our hips and mobility in our upper back. So this little contraption is 2 tennis balls wrapped up in tape. It was a physical therapist that invented this out in Arizona named Sue Falsoni. I have to give credit where credit is due. What it does is it'll actually give you some extra mobility in the spine by almost acting as a massage. Okay, so Chelsea's going to lay on her back in a second, and we're going to start to work from the middle of her back. She'll do a few crunches over the ball, about 5, and then she'll move it up a segment, do another 5 crunches over it, and then another segment, and do another 5, another segment until she's up to about here. Okay, what that's going to do is just basically get the spine to move over the tennis balls and dig in a little bit into that area of tightness. Okay, so she places the tennis balls right in the middle of her back and then starts to progress through a few small crunches over the ball. Okay, making sure she's breathing and relaxing her neck as much as possible. This could be pretty painful when you first start it. Okay, so a few crunches and then move up a segment and then through another range of motion, just letting that spine relax over the ball. And she'll move through the next few segments up the back. That's good. After getting some mobility through some soft tissue work with the tennis balls in your back, now what you want to do is go through a few stretches. So what Chelsea's doing is sitting her butt back on her heels, maintaining perfect posture, head up, eyes out on the horizon. She'll go ahead and she'll rotate to one side and then crunch away from the other elbow. Okay, so she's reaching down and crunching to the side. Then she'll go ahead and get a little bit more extra range of motion and then go ahead and crunch again. Then you should feel a little stretch on the outside arm and scapula on this side. Just one more and crunch. And then back to the center. And then she'll go ahead and she'll go through the same progression on the other side, staying tall, crunching, side bending out to the side. Back to the middle, she'll rotate a few more degrees and then go ahead and crunch again. The whole time she's really trying to work on mobility of the upper back, not lower back. So the lower back stays locked in with the hips. Everything else from the middle of her torso up is going to do the rotation. What we're going to go through now is just getting some stability in the shoulder joint. So Chelsea will go ahead and pinch her shoulder blades back and down and then go ahead and lift up into a Y pattern with her thumbs up to the ceiling. Okay? Most people, when they start to do this, will crunch their neck and they'll start to use their traps. What I want to see you do is try to work on driving your scapula down and back, feeling that pinch back here in the middle of your back, and then lifting through that range of motion in a Y pattern. After that, she'll go ahead and spin her thumbs out to the side, do that same pinching action with the shoulder blades, and then reach out to the side, trying to get her fingers as far away from each other as she can. So it's a shoulder blade down and back movement, and then out to the side. And that's good. Go through 2 more. Just a few more. So just like the legs, where we worked on our stretching, which in my world would be mobility, and then some stability or some activation in the muscle, we had to progress to the Kaiser and work on some kind of functional movement pattern to tie that strength and stability and mobility into some kind of thing that's going to help us in daily life when we move around. We have to do the same thing for the shoulder. Just because we worked on getting that mobility and then working through that range of motion for some strength doesn't mean that it's actually going to actively happen when we do things day to day in life. So we're going to go ahead and have Chelsea squeeze this pad. What that does is it's going to get her adductors of her legs to fire, which in turn helps her to stabilize her core, which we know we want to keep as stable as we can. And she's going to go ahead and reach all the way up and back to get as much range of motion through her upper torso as she can, and then work through this arm sweeping motion. Okay, squeezing the pad the whole time. She'll reach and turn her thumb down on the way down and then reach up and over the top of her head. The whole time the shoulder has to stabilize along with the torso. So trying to keep her elbow as close to the ground as she can and reaching her fingertips out as far away from her body as she can. Reach all the way out. And just 2 more. Down and over the top. Hopefully you can take some of these exercise progressions and pull them into your current program, and make sure you stay tuned to the next newsletter to see some of the following progressions.